Hey guys, it's early 2022, January. It's time that we're going to be verifying coverage again because most of the new patients that are coming to you probably have not met their deductible. And so I want to share our process, just verbally explain to you what we do when a new patient calls to verify coverage, to check and confirm out-of-pocket cost for the patient, and how I think a good verification process in the beginning of care leads to decreased drop-offs and increased completed plans of care, because one of the biggest reasons why patients quit coming is they're getting scared that they don't know how much this is going to cost them. So let's talk about it. If you guys don't know me, my name's Tony Maritato. I'm a licensed physical therapist and private practice owner, and this channel is dedicated to helping clinicians, PTs, OTs, SLPs really find their financial freedom and independence by learning how to do things themselves in their own business. So what do? If we have patients that are continuing services beyond the end of the previous calendar year, so it's December 30th and we knew this patient's going to be scheduling into January, we go ahead and start verifying coverage immediately before the new year even begins, because we want to have a plan of care, a plan of action in place for this individual, because if they're going to have a high copay, high coinsurance, or a deductible that resets January 1st, we want to make sure that they don't end up with a big unexpected financial liability that is going to cause a burden on them to continue to come to therapy. So we verify coverage on every existing patient when we're switching over into a new year. And of course, we verify coverage on every new incoming patient before they begin. We do not let any patient come to an initial evaluation without fully being aware of exactly what the out-of-pocket cost is going to be. And we, for 21 years we've been in private practice, we have always provided a guarantee on what the maximum out-of-pocket cost will be, even if for some reason the insurance changes or switches or something happens, because we want the patient to have the peace of mind of knowing this is the absolute most it will cost me. It's just like when I bring my car into the automotive shop. I want to know before you do anything, what is this going to cost? All right, it's a $79 diagnostic, and then if we decide to do the services, that $79 comes off the cost of the service. Awesome, that's perfect. I'll bring my car to you every time. But I need to know before I get started what it's going to cost. So our process, now, if you don't know my practice, I have 2 physical locations right now, outpatient orthopedic clinics. We have admin staff and we have clinical staff. But basically what happens is we have 2 ways to verify coverage. The most convenient way, the quickest way, the easiest way is using a clearinghouse to verify eligibility and coverage. Now you can use Availity, you can use Ability, you can use Office Ally, you can use any of the major clearinghouses. You can also use a service like Reimbursify, which I'll put a link down in the description for Reimbursify. If you're doing out-of-network claim submission, or you're billing out of network and you want your patient to have the best opportunity to receive reimbursement for an out-of-network claim, absolutely, I would recommend using Reimbursify. I've interviewed one of the founders and CEOs on the channel. Go check out that video. But it's an amazing platform. The client can do all of it themselves. It's incredibly cheap for the reimbursement and the customer support that they get. Check out Reimbursify. But in the meantime, so if we're going to use a clearinghouse or some sort of electronic verification process, we need the patient subscriber ID. We usually need the patient's date of birth, the first name, the last name. Those are the 4 components that we typically need. We'll put that into the system. We'll run the benefits check. We'll see what it is for in-network, for out-of-network. We'll see the deductible, how much of the deductible has been met, the out-of-pocket maximum, how much of that has been met. We'll see if there's a visit limit or if there's a copay or a coinsurance. We'll collect all of that information from the online resource. We'll put all of that information into a document that summarizes what the patient can expect. And then at the initial evaluation, at minimum, we'll have the exact, because we know for the initial evaluation, we're going to build the CPT code for the eval. We're probably going to have the ability to bill CPT codes for 1, 2, maybe 3 units of service. So we will have a pretty clear estimate of exactly what the patient's out-of-pocket max, or excuse me, out-of-pocket cost is going to be for that visit. So before they actually arrive to the clinic, we call them back and we let them know this is the estimated cost based on the summary we received from the online portal. Now, if it's a third-party payer that doesn't have an online portal, or we can't get them through our clearinghouse, we go ahead and call the insurance company. Now, doing it online, it'd be like 30 seconds to verify coverage. Doing it on the phone, it's probably going to be closer to 20 to 30 minutes. I have a video of me actually verifying my own coverage as if I was the patient, and it took me about 17 minutes from start to finish to go through and get all of the information. But the idea is that you want to be prepared when you call the insurance company. You want to have the beneficiaries, first name, last name, date of birth, member or subscriber ID. You want to know who is the insured on the policy, because sometimes the policy holder might be different from the patient. And you want to have your list of questions. And so we want to know, what is the deductible? How much of the deductible has been met? What is the out-of-pocket max? How much of that has been met? Does the patient have a copay or a coinsurance? Does the patient have a visit limit? Does this insurance policy require us to submit prior authorization or authorization after the initial evaluation? These are all the questions that you want to get answers to. And once you have that verbally, you want to get a confirmation number for the call and get the name of the customer service representative that you spoke to. So these are important components if you're going to be doing telephone verifications. And they're going to tell you, and I'm going to reiterate, that whatever they quote you is not a guarantee of payment. So what they're saying is, this is the best information we have. We're not totally sure how it's going to process once it comes into the system, but this does not guarantee payment, even though we said these are the benefits. And that's where we came up with our own way to guarantee what the cost is going to be, because the worst case scenario is for a patient to come in, receive services, and have no idea what the expense is. So guys, if you are working on your insurance verification process, if you're looking for ways to make it work, there are other websites, there are other services, but this is absolutely probably one of the biggest customer complaints is not knowing what the exact cost is going to be, coming in, receiving a service, having no idea where, what the insurance is going to pay, how long they're going to be there, all of these things. So this will go a long way to you guys improving the patient experience, improving patient compliance, reducing drop-offs, and improving completed plans of care. If you have other questions, let me know. If you want to see what other video, there it is, YouTube thinks you might want to watch, check out this thumbnail. Otherwise, I'll catch you guys on the next video.